So in this study, we look at the benefit of rituximab maintenance after first-line bendamustine rituximab in patients with mantle cell lymphoma. So as we know, BR has been increasingly used for patients with mantle cell lymphoma who are older or unfit for stem cell transplant. Rituximab maintenance has been shown to improve survival benefits in several settings, including after R-CHOP for elderly patients in the European MCL elderly trial, and also in younger patients after transplant, as shown in the LIMA trial. In the setting of frontline BR, whether rituximab maintenance also improves survival outcomes has not been established. There has been a small phase 2 randomized trial done in Germany and Austria that interestingly showed no PFS or overall survival benefit with rituximab maintenance. However, since then, several retrospective studies, mainly done in the United States, have suggested a potential benefit of rituximab maintenance in this setting. For example, the Flatiron database, which mainly involved patients who were treated in the community oncology setting, showed that rituximab maintenance after frontline BR can improve time to next treatment and overall survival. And a small 12-center U.S. Academic center collaboration plus British Columbia data also suggested that rituximab maintenance can improve PFS and OS. But some of these retrospective studies are limited by the sample size in academic settings. So in this study, we assembled a large cohort from 26 centers in the United States to further look at this question. And we also did a landmark analysis, meaning patients have to respond to BR in the front line and then remain event-free for 3 months to be eligible for this landmark analysis of rituximab maintenance benefit. Because if the patient have an event within the 3-month mark, those are patients who are more likely to have not received rituximab maintenance. So if we include these events in the analysis without landmark, these events would exaggerate the potential benefit of rituximab maintenance. So in this study, we had about 800 patients who started the first-line BR. And then we have about 600 patients who were eligible for the landmark analysis. The dropout is because of the missing data of response to BR, and some patients did not have confirmed CR or PR to the first-line treatment. And some patients, of course, dropped out with the first 3-month follow-up before the landmark. So with the 600 patients, it's about a 1-to-1 split of who received or not received rituximab maintenance. The baseline characteristics are largely balanced between the two groups. And importantly, all the high-risk features such as high simplified MIPI, Ki67, bulky disease, TP53 mutation, complex karyotype, etc., are all balanced between the two groups. With that, and about 5.5 years of follow-up since first-line BR, we observed that rituximab maintenance can significantly improve survival outcomes, including event-free survival, event-free survival 2, which is defined as from the time of landmark to progression, relapse, retreatment, following second-line treatment, or death at any time, and also improved overall survival significantly. So in terms of the magnitude of improvement, the 5-year rate of EFS is somewhere 50 versus 30%, and EFS2 about 60 versus 40%, and overall survival about 70 versus 55% in 5 years mark. And if we look at the Cox regression model adjusting for sex and a simplified MIPI, the magnitude of benefit is about 0.6 or 40% risk reduction. And then looking at patients who responded with a complete response to BR versus only a partial response to BR, we saw that the benefiting CR patients were very clear. In the PR subset, however, because of the small sample size, the differences were not statistically significant. So taken together, our study and other retrospective studies now combined with almost 2,500 patients together show a consistent benefit of rituximab maintenance after first-line BR in patients who are not eligible for stem cell transplant. So with all these data, we think it's very reasonable to offer rituximab maintenance in this setting.